Welcome to Pediatric Podcast for PedsCases.com.
Welcome back to the PedCases Advocacy podcast series. My name is Dr. Katie Boone, and I'm here along with two of my co-residents, Dr. Betcherman and Dr. Amelia Kellar. We are pediatric residents at the Hospital for Sick Children in Toronto. This podcast series is developed with the help of Dr. Charlotte Moore Hepburn, a pediatrician at Sick Kids and Canadian Pediatric Society Director of Medical Affairs. This is the second in a three-part series on advocacy. In the first podcast, we introduced you to the concept of public policy advocacy. In this podcast, we will address how to better understand the various levels of government and how to design your advocacy project. To create and execute an effective advocacy campaign, it is important to have a clear plan of action. This often involves interacting with government and policymakers. In this section, we will discuss the different levels of government and their various roles in public policy. Next, we will discuss how to identify stakeholders and construct a power map. Last, we will discuss how to develop a strategy and execute your project, mainly by setting goals to help your project be objective-focused rather than activity-focused. As a start, it is important to understand the scope, roles, and authorities of different levels of the Canadian government, and to identify which level of government is best to address. For example, an intervention to improve education for children through curriculum reform may be addressed at the provincial level. A project to address a consumer product safety issue may be addressed at the federal level, and a program to improve refugee integration may be addressed at the municipal level. Let's look at the structure of the Canadian government. Overall, the federal and provincial governments are structured similarly. Each has a legislative, executive, and judicial branch. The federal legislative branch is Parliament, which is made up of two houses, the Senate and the House of Commons. The House of Commons is made up of elected representatives called Members of Parliament, who represent the electoral district from which they were elected for a period of 4 years. Senators, however, are appointed by the Governor-General with the guidance of the Prime Minister. The House of Commons generates the majority of new legislation, and the principal function of the Senate is as a sober second thought on federal level public policy. The executive branch has a sovereign and an elected representative, the Prime Minister or Premier. The elected representative is supported by his or her office, cabinet, and ministry. Cabinet members are appointed by the Prime Minister or Premier and tend to serve in their portfolios for 2 to 4 years. The ministries are staffed by bureaucrats, many of whom serve in their positions for 5 or more years. In the Constitution, there are only 2 sanctioned levels of government, provincial and federal. However, provincial governments can delegate authority to municipal governments. Municipal governments can be divided into upper tier and lower tier. Upper tier municipal governments refer to counties, districts, and regions. These are led by a chair or warden. Lower tier municipal governments are cities, towns, and municipalities and are led by a mayor. These are also elected positions. The federal government is responsible for defense, criminal law, trade regulations, external relations, transportation, money and banking, citizenship, employment insurance, postal service, census, copyrights, and Indigenous affairs. The federal government will be particularly important if your project involves Indigenous healthcare, consumer product safety, drug approvals, or national-level public health surveillance, such as rare disease or national cancer surveillance. The provincial government is responsible for property and civil rights, education, social welfare, as well as the management, operation, oversight of the healthcare system. It is also responsible for administration of justice, natural resources, prisons, age of majority, and natural resources and the environment. The term used to refer to provincial representatives varies across the provinces, but most refer to them either as a member of provincial parliament, or MPP, or as a member of the Legislative Assembly, or MLA. The provincial government is often a target for health proposals, particularly if your project involves changes to the larger health system and its funding, addressing social assistance, childcare, or the public education system. The municipal government covers local issues which may be involved in your advocacy project, such as water, land use planning, libraries, and emergency services. It is also responsible for sewage and waste collection, public transit, animal control, and economic development. The municipal government may be best to target if your project involves the regional public health authority, local government bylaws, the local school board, or local planning like community outreach for the homeless. It is important to note that your project may involve multiple levels of government. If it seems that multiple levels of government may need to be engaged for the project to go forward, consider either narrowing the project to involve only one level or ensure that the different levels are engaged at the right time in the project to address the appropriate aspects of the project as it goes forward. Once you have identified the issue at hand and you know what level of government you should target for your project, it is important to lay out your proposition in a way that policymakers will understand. First, paint a picture of the landscape for your issue. Try to understand how your jurisdiction compares to others. For example, are there many jurisdictions doing this, or will this be a new concept? Second, scope your issue. When approaching government, it is critical to have a narrow scope with a specific ask. Focus in on one specific change to legislation, or better enforcement of a specific bill, for example. This narrow scope allows for concrete downstream effects and will prevent the project from becoming too lofty or complicated. Once you have a sense of the landscape and scope, you can set strategic objectives, determine potential projects to meet these objectives, and decide on the best solution. Also, consider how you might evaluate the project early on so that this essential component can be integrated into the planning and implementation stages. Last, the policymaking process is very dependent on the election schedule. Representatives will try their best to hold true to the promises they made during their campaign. Try to target representatives whose platform is consistent with the change you are proposing. You might also consider approaching candidates with potential projects prior to an election to insert the policy change into their platform. As a healthcare provider, it is likely clear to you that your intervention is the right thing. However, the right thing from a healthcare perspective may not be the right thing from a government perspective, as there are many different stakeholders to take into account. It is important to acknowledge that government officials need to incorporate many different viewpoints into their decision-making before approaching them. Most importantly, you can anticipate these perspectives and potentially alter them or highlight them during your meeting. As we discussed earlier, the government official will try their best to stay true to their platform, as well as to their close strategic stakeholders. They will also be considering public perception of the issue, as they will be hoping to be reelected. During your meeting, you can highlight how the proposed intervention fits into their platform and is advantageous to their key supporters or strategic stakeholders. The last step in project design is strategic development. This refers to the combination of stakeholder analysis, power mapping, and goal setting. By combining all of these activities, an approach to government advocacy can be made. This outline should be put on a timeline with a specific budget assigned to each task and with specific responsibilities assigned to those participating. There should be check-in meetings intermittently to keep the group on track. It is important to keep your endpoint in mind and try not to become too focused on individual activities, but keep a big picture perspective, focusing on objectives and goals. This is a critical step in project development and can be very time intensive. However, it is essential to the successful completion of a project. Stakeholder analysis is a critical important of strategy development. As we discussed, the first step is to determine the level of government that is most important to target. Then you should identify specific persons in government who have the power to make your proposed change. Try to determine who contributes to decision-making around your topic of interest and when those kind of decisions are made, keeping in mind the election cycle. Try to determine who your allies and opponents may be. Try to anticipate what arguments your opponents will present and how you will deal with them in advance. Determining key stakeholders is time-intensive, but will yield important dividends if a positive relationship can be formed, at the right time, with someone who has the power to implement your project. The easiest way to approach stakeholder analysis is to make a power map. First, choose a critical decision maker who has the power to implement your project. From there, try to map the influences at play for that person. These can be other political party members, associations, financial backers, colleagues, and family. Target these priority relationships. Try to find out more about influential groups or people and meet with them as well to discuss your idea. Develop a plan to access the individuals you have identified. Formal meetings are best, but impromptu meetings can also be influential. The final step in strategic development is goal setting. Of course, the end goal of any project is successful implementation of the intervention. However, it can sometimes be difficult to decide what route to take to get to the final goal. One simple way of approaching this daunting task is to break down the final goal into a series of smaller objectives. Once you have identified which smaller steps can lead you to your larger goal, you can identify single activities that will progress your project from goal 1 all the way to the final implementation of your project. This series of goals can be placed on a timeline, which allows you to break down the project into smaller, manageable pieces. It is important for the goals to be outcome-focused rather than activity-focused. For example, an activity might be to run a public campaign, perhaps a fun run in support of your intervention. The outcome of this would be to increase public awareness and to spark conversation in your community. The danger is that often people will begin to focus too much on the activity itself, the fun run, rather than the ultimate goal of the campaign, to increase awareness and spark conversation. Becoming activity-focused can sometimes lead the project away from the initial goals and objectives. Try to prevent this by continuously asking, how will this activity lead me to my interim and final goals? In summary, designing your project prior to beginning work is critical. Decide which level of government your project falls under. Look into the landscape in that area and create a narrow scope for your project. When approaching government, think about the issue from their perspective. Remember, money talks. Last, develop a strategy to implement your project by determining key stakeholders and understanding their relationships through power mapping. Come up with outcome-oriented goals that can be accomplished by a series of activities. Apply these goals and activities to a timeline with people and a budget assigned to each activity. Have frequent check-ins with your team to ensure things stay on track. That brings us to the end of part 2 of our Advocacy podcast series. In the next podcast, we will discuss how to implement and evaluate your advocacy project. Thanks for listening.
Check out www.pedscases.com for more great podcasts, videos, interactive cases, questions, and more. Press subscribe on iTunes to get access to all of our podcasts. If you like what we do, please leave a review on the iTunes store, share with your friends and colleagues, or think about getting involved.